Absolutely. Let's delve into the world of home remedies and uncover some popular ones that, despite their widespread use, don't actually hold up under scientific scrutiny. It's fascinating how some remedies have become household staples, passed down through generations, even though they might not be as effective as we think. Let's explore these myths and set the record straight. The myth of vitamin C for colds. We've all heard it. At the first sign of a cold, load up on vitamin C, whether it's through supplements, orange juice, or those fizzy tablets. Many people swear by this remedy. However, the science tells a different story. While vitamin C is essential for overall health and can support the immune system, studies have shown that it doesn't actually prevent colds. At best, it might slightly reduce the duration of a cold, but it's not the miracle cure many believe it to be. So while it's always good to get your daily dose of vitamin C, don't expect it to be a magic bullet for your sniffles. The Vicks VapoRub on feet trick. This one is a classic. When you're battling a cough, some people suggest slathering Vicks VapoRub on the soles of your feet and then putting on socks before bed. The idea is that it will somehow alleviate your cough. Unfortunately, there's no scientific basis for this remedy. Vicks VapoRub can be effective when applied to the chest or throat, where the menthol vapors can help open up airways and reduce coughing. But putting it on your feet? That's just a placebo effect at best. Stick to using it as directed for the best results. Cranberry juice for urinary tract infections. Cranberry juice has long been touted as a natural remedy for urinary tract infections, UTIs. The theory is that compounds in cranberries can prevent bacteria from adhering to the walls of the urinary tract. While there is some evidence that cranberry products might help prevent recurrent UTIs in some people, drinking cranberry juice is not an effective treatment for an active infection. If you have a UTI, it's important to see a healthcare provider for appropriate treatment, usually antibiotics. Relying on cranberry juice alone can lead to complications and prolonged discomfort. The bread and butter for burns folly. It's an old wives' tale that applying butter or bread to a burn can help soothe the pain and promote healing. In reality, this can do more harm than good. Butter can trap heat in the skin, worsening the burn, and bread offers no medicinal benefits whatsoever. The best immediate treatment for a minor burn is to run cool, not cold water over the affected area for several minutes. This helps to reduce the temperature of the skin and prevent further damage. After cooling the burn, you can apply a sterile bandage or an over-the-counter burn ointment. If the burn is severe, seek medical attention. The myth of detox diets. Detox diets and cleanses are all the rage, promising to rid your body of toxins and jumpstart your health. These diets often involve consuming only juices, teas, or other specific foods for a set period. However, the concept of detoxing the body is largely a myth. Your liver, kidneys, and other organs are perfectly capable of eliminating toxins without the need for special diets. In fact, some detox diets can be harmful, leading to nutrient deficiencies and other health issues. Instead of falling for detox fads, focus on maintaining a balanced diet, staying hydrated, and getting regular exercise to support your body's natural detoxification processes. The onion in the sock remedy. This one is quite peculiar but surprisingly popular. The idea is that placing a slice of onion in your sock overnight can help draw out toxins and cure illnesses like the flu or a cold. Proponents claim that the onion's natural properties can absorb toxins through the skin. However, there's no scientific evidence to support this remedy. While onions do have some antimicrobial properties, there's no mechanism by which they can draw out toxins through the skin. If you're feeling under the weather, it's best to stick to proven methods like rest, hydration, and over-the-counter medications. The truth about ear candling. Ear candling involves placing a hollow candle in the ear canal and lighting it, with the belief that the heat will create a vacuum to draw out earwax and impurities. This practice is not only ineffective but also dangerous. Studies have shown that ear candling does not create a vacuum or remove earwax. Instead, it can cause burns, ear canal blockages, and even perforate the eardrum. If you have excess earwax, it's best to use over-the-counter eardrops or consult a healthcare provider for safe removal. The perils of using baking soda for heartburn. Baking soda or sodium bicarbonate is sometimes recommended as a quick fix for heartburn. While it can neutralize stomach acid and provide temporary relief, it's not a long-term solution. Regular use of baking soda can lead to an imbalance in electrolytes and cause other health issues, such as high blood pressure due to its high sodium content. For persistent heartburn, it's better to use antacids specifically designed for this purpose or consult a healthcare provider for appropriate treatment. The ineffectiveness of toothpaste on pimples. Many people swear by applying toothpaste to pimples to dry them out and reduce inflammation. While toothpaste does contain ingredients like baking soda and hydrogen peroxide that can have a drying effect, it's not formulated for use on the skin. Toothpaste can cause irritation, redness, and even burns, especially if left on the skin for too long. Instead, use products specifically designed for acne treatment, such as those containing benzoyl peroxide or salicylic acid. The misconception of using alcohol to lower fever. Rubbing alcohol has been used as a home remedy to lower fever by applying it to the skin. The idea is that the alcohol will evaporate quickly, cooling the skin and reducing body temperature. However, this practice is not only ineffective but also dangerous. Alcohol can be absorbed through the skin, leading to alcohol poisoning, especially in children. The best way to manage a fever is to use fever-reducing medications like acetaminophen or ibuprofen and to stay hydrated. If the fever is very high or persistent, seek medical attention. The fallacy of using butter for bruises. Applying butter to bruises is another old remedy that doesn't hold up to scientific scrutiny. Butter has no properties that can help reduce bruising or speed up healing. In fact, applying butter to a bruise can make it more difficult to clean the area and may even introduce bacteria, leading to infection. To treat a bruise, it's best to use a cold compress to reduce swelling and pain, followed by rest and elevation of the affected area. The ineffectiveness of using vinegar for sunburns. Vinegar, particularly apple cider vinegar, is sometimes recommended as a remedy for sunburns. The idea is that the acetic acid in vinegar can help soothe the skin and reduce inflammation. However, applying vinegar to sunburned skin can actually cause more irritation and discomfort. The best way to treat a sunburn is to use cool compresses, aloe vera gel, and over-the-counter pain relievers. Staying hydrated and avoiding further sun exposure are also important. The myth of using mayonnaise for lice. Mayonnaise is often touted as a home remedy for head lice, with the belief that it can suffocate the lice. While mayonnaise might make the hair greasy and difficult for lice to move, there's no evidence that it effectively kills lice or their eggs. Instead, use over-the-counter lice treatments that are specifically designed to eliminate lice and follow the instructions carefully. It's also important to wash bedding, clothing, and personal items to prevent reinfestation. The misconception of using butter for frostbite. Applying butter to frostbite is a dangerous and outdated remedy. Butter can trap heat and moisture, worsening the frostbite and increasing the risk of infection. The proper treatment for frostbite involves gradually warming the affected area with warm, not hot water, and seeking medical attention as soon as possible. Avoid rubbing or massaging the frostbitten area, as this can cause further damage. The ineffectiveness of using olive oil for ear infections. Olive oil is sometimes recommended as a remedy for ear infections, with the belief that it can soothe pain and reduce inflammation. While olive oil might provide some temporary relief, it does not treat the underlying infection. In fact, putting any liquid in the ear can potentially worsen the infection or cause other complications. If you suspect an ear infection, it's best to see a healthcare provider for appropriate treatment, which may include antibiotics. The fallacy of using lemon juice for lightening skin. Lemon juice is often recommended as a natural remedy for lightening dark spots or evening out skin tone. While lemon juice does contain citric acid, which can have a mild exfoliating effect, it can also cause significant irritation and increase the skin's sensitivity to the sun. This can lead to burns, hyperpigmentation, and other skin issues. For safe and effective skin lightening, it's best to use products specifically designed for this purpose and to consult a dermatologist. The misconception of using butter for hemorrhoids. Applying butter to hemorrhoids is another outdated remedy that offers no real benefits. Butter has no medicinal properties that can help reduce the pain, swelling, or discomfort associated with hemorrhoids. Instead, use over-the-counter treatments like hydrocortisone creams or witch hazel pads and make dietary changes to include more fiber to prevent constipation. If hemorrhoids are severe or persistent, seek medical advice. The ineffectiveness of using baking soda for teeth whitening. Baking soda is often recommended as a natural teeth whitener. While it can help remove surface stains due to its abrasive nature, using it too frequently can damage the enamel and lead to tooth sensitivity. For safe and effective teeth whitening, it's best to use products specifically designed for this purpose or consult a dentist for professional treatments. The myth of using vinegar for dandruff. Vinegar, particularly apple cider vinegar, is sometimes recommended as a remedy for dandruff. The idea is that the acidity of the vinegar can help balance the scalp's pH and reduce flakiness. However, there's no strong evidence to support this claim, and vinegar can actually irritate the scalp, especially if there are any open sores or scratches. For dandruff, it's best to use medicated shampoos that contain ingredients like zinc pyrithione, salicylic acid, or ketoconazole. The misconception of using toothpaste for burns. Applying toothpaste to burns is a common but misguided remedy. Toothpaste can contain ingredients that are not suitable for broken or damaged skin, and can cause further irritation or infection. The best immediate treatment for a burn is to run cool water over the affected area for several minutes, then cover it with a sterile bandage. For more severe burns, seek medical attention. It's fascinating how some home remedies have become so ingrained in our culture, despite lacking scientific support. While many natural remedies can be effective and beneficial, it's important to approach them with a critical eye and rely on evidence-based treatments for serious health issues. Always consult with a healthcare provider before trying new remedies, especially if you have underlying health conditions or are taking other medications. Your health and well-being are too important to leave to chance.